Dr. Vuyane Mhlomi. Um, I know he prefers to go by just Vuyane. As
Please.
Yeah, so to say I am really excited for this conversation today would be an understatement. And I'm lucky to be talking to Vuyane today because he is someone that I happen to know personally and is one of the most inspiring people I know. Vuyane is currently the CEO and co-founder at Quro Medical. So the questions I'll be asking really relate to Vuyane, the person in front of me, and also the work that he does. Vuyane, welcome to the platform, and thank you for actually giving us your time.
Thank you so much for the invitation, and it's really my pleasure being here.
Yeah, sure. Let's jump right in. So you are the youngest guest I've had on this platform, and I think that says a lot about the brilliant work that you've been able to do at a young age. The first question I usually ask my guests is for them to tell us who they are, where they were born and grew up, and what kind of experiences, if any, do they think actually inspired them to do the work that they currently do.
My name is Vuyane Mhlomi, and it's interesting because a lot of people tend to misspell my name, even though it's correctly spelled. So Vuyane traditionally spelled with an I, but my name was a home affairs error that I chose to embrace, and that's spelled with an E. I used to think that made me special until I logged onto Facebook and realized that, there were many of us that had that same typo. I grew up in a township in Cape Town called Khayelitsha. It's one of the largest townships there, and born to an incredible woman. Her name is Nomsa Mhlomi, and my dad, interestingly, died in 1999 when I was 11 years old, on the 22nd of Feb, which is 2 days before my birthday, which is happening on the 24th of Feb. I have got three really cool brothers. We are all very different, even though we are all super entrepreneurial. And but I've always been the child that leaves home very early. So as soon as I matriculated and went to varsity, that was my leaving home. So I'm the only one that's actually based in Johannesburg at the moment, and most of my family is largely based in Cape Town. Very athletic. Triathlon training at the moment. I enjoy running, cycling, and swimming. Um, I enjoy things that challenge me, I guess. And so these were, I'd always been a cyclist, but I was never good at swimming and cycling, swimming and running. So that's one of the things that I've been challenging myself. But apart from that, I think I'm an academic at heart, but also try to, like the practical and the translation of that knowledge into something meaningful and impactful, which is where I find myself at the moment as an entrepreneur. So I'm at the intersection of business science and entrepreneurship, and I look forward to tell you more about the exciting stuff that we do.
Yeah, sure. Thank you for that elaborate response. And actually, yeah, you touched upon things that are important for the next question, which is you did your medicine degree, you did your internship, you did your ComServe as a doctor in South Africa. And then after that, decided to pursue your PhD in cardiovascular medicine at Oxford. Could you please tell us why that choice was made at that time? What are the factors informing that decision?
So one of the things that inspired me to do medicine, my dad was quite sickly, and so was my mom. My dad had diabetes, and very poorly controlled diabetes. He would go into diabetic comas. I distinctly remember having to get off the train when we come back from school to go and pick up his clothes because he's in another coma. And every time we go to the hospital, we would see that at times he would be waiting for hours on end to be seen by a doctor. And I wanted to be part of the solution. And at that point, I was clear that I wanted to do medicine because South Africa needed doctors, and I wanted to be that doctor.
Yeah.
Fast forward to the eve of my matric exams, and my mom has a stroke. And we pick this up early. She gets sent to Groote Hospital, where they dissolved the clot that had formed in time, and as a result had very minimal neurological, kind of long-standing neurological damage. And here was I, a witness to a healthcare system that on one hand could not save my dad. And I could see that actually when this thing works, it can potentially be life-saving. And so that sort of cemented my decision to go and study medicine at UCT. Also, I'm always big on study where they offer it best. UCT was the best institution, and I wanted to go to UCT. And I went to UCT, loved I mean, I reflect on my undergraduate years with what was it? Those are super nostalgic memories for me because I really had the time of my life. Just being intellectually stimulated, the relationships I developed there, I still have. I admire my colleagues, my senior colleagues, that some of whom have now become friends and collaborators, etc. Um, and then I was clear, even at the end of varsity, that I wanted to go to Oxford. I had heard that Oxford was this incredible institution. There were leaders in the healthcare sciences. Prof. Mayosi had studied cardiovascular medicine at Oxford, and I wanted it. And I distinctly remember when everybody was buying the black graduation gown. One, I didn't have the money, but also how I consoled myself was that this gown that I would buy is the scarlet robe from Oxford, and I'm making this decision with myself, or this compact with myself in um, in 2011. Fast forward, I go to work at Baragwanath Hospital, and which everyone knows is a pretty intense place to
Yeah.
work. I was sitting in the medicine clinic, and I had a hypertensive patient, or a patient who has high blood pressure, who came in, and umama umdala, scary blood pressures. And she said that, I asked her about, has she taken her medication? And she said, well, my medication was not delivered.
Mm.
And so she could not take the medication. When it was eventually, when she could eventually find some medication at the clinic, she didn't take them before coming here because she was told that she needs to eat
Yeah.
before she takes more medication. And it was clear to me that the challenges that were facing our people were not just, as we kind of reduce it to adherence to medication, etc. They were a lot more profound. And at the time, there was a body of work that was being produced by researchers in different parts of the world that followed patients who were born to mothers who develop high blood pressure in pregnancy. And what they communicated in their work was that, or at least what they discovered, was that children who are born to mothers who have high blood pressure during pregnancy, a condition called preeclampsia. And again, I'm being very simplistic. So preeclampsia is a lot more complex than just simple kind of high blood pressure in pregnancy, because we always make a distinction. But children who were born to particularly mothers who have preeclampsia were primed to develop cardiovascular disease later on in life, right? And it looks like, actually, if we could switch off this thing in utero, then we could potentially have a chance. And we, potentially dealing with hypertension and high blood pressure later on, then I don't have to worry about about a government who's not delivering medication. I don't have to worry about a patient having food before she, you know what I mean? Because
Yeah.
this is a non-starter. So I wanted to, and at the time, Oxford was doing this amazing work in this space in preeclampsia and cardiovascular research. And I was like, I wanted to apply. In fact, I applied to Oxford before I applied for the Rhodes Scholarship, Um, and it's quite funny because I I sent an email and they didn't get back to me. And then I loaded Skype credits. I called the department because I wanted to find out, well, why are you not responding to my emails? And on the other side, the guy that would be my supervisor, Professor Manuvatesh, who was a Fulbright scholar, him and I spoke. I told him that I had aspiration of applying for the Rhodes Scholarship, and that's how I got into the PhD.
Yeah.
Fast forward, do the PhD again. Really, really enjoy my time. Very rigorous training and programs. Very supportive supervisor. Amazing community of people, both within the lab and as well as the Rhodes community. But what used to frustrate me was that, there were about 5 or 6 people who were truly interested in the work that we were producing. You'd publish this thing, and I became increasingly, you know, uh, what is it? I'm trying to think. Impatient, right? I became increasingly impatient that where I come from, there was an urgent need for solutions. But the nature of the work, as impactful as scientific work becomes, the wheel turns very, very slowly before it actually translates into anything meaningful. What I also realized, I mean, you would know this, that PhDs are generally very, very lonely journeys. You spend a lot of time reflecting and thinking about life. And I started reflecting because when I came to Oxford, I was going to finish this PhD and I was going to do cardiology.
Yeah.
But I also realized that there were a lot of my colleagues that were incredibly talented that I had gone through my training, who would become exceptional cardiologists and physicians. And our healthcare system, if it was going to change, required us to forego traditional paths and be willing to do something different. I was also very clear that the space that I needed to occupy post this period is one where I can be independent and autonomous. And so while I love academia, it would infringe in part in in my ability to be able to do that. And I'd always been gay entrepreneurial. I started the first internet cafe way back when in varsity, in school. While I was in high school, I would type people's assignments after I come back from school, kuyo yonke loo nto. And then at the end of the DPhil, I then decided that and I needed to complete a degree that would supplement my clinical training with a bit of business knowledge that I had. And that's why I ended up doing the MBA. And as soon as I landed in South Africa in 2018, post MBA was the beginning of us building Quro, or rather, we started building Quro back in 2017, but like setting up the structure and actually building the company.
Yeah, sure. That sounds very interesting, actually. And again, you seem to be predicting my questions before I even ask them, because I was going to ask you next that you knew the late Professor Vuyane Mhlomi. Could you please tell us what relationship the both of you had and what your experience of him was?
Professor Mayosi, I knew Prof Mayosi before he knew me first, right? And I remember, I mean, his story is legendary. Here was an like an exceptional clinician, who just happened to be Black. But recognized the importance of being a Black clinician in a predominantly white environment. His desire for transformation, for the betterment of our people, was clear. He was also clear that there'd be a need to train PhDs, because if we're not producing scientists or clinician scientists, we are not going to generate kind of Afrocentric research. We'll always have to adapt whatever research has been done, from abroad. He knew that we needed to train teachers that could speak our language, because we were having very smart medical students, but language became increasingly a barrier. He was exemplary in his conduct. He was a clinician par excellence. So I knew all of these things about this man, but he was kind and generous with his time. He was accessible. And so the first time I had a real encounter is when I started, actually, is when I was president of the Health Science Student Council. And he at the time wanted to set up what we have now which is the intercalated MBChB PhD program, and he wanted student representatives. So I attended this, and I was like sitting here, and this man's, vision was like light years ahead of, everybody. And I was just sitting there in awe. The second time I meet him was in a tutorial, and, and he was teaching us, and, really just thoroughly impressed. And I was clear that after that tutorial, I wanted to be Vuyane Mayosi. And I would emulate him in his dress. I couldn't do his walk, uh, but everything else, I would clock twice as many patients as I needed to. I would attend Thursday lectures, because that's where every other clinician was. And so when I then was interviewed for the gold medal for medicine in my fourth year, he was one of the examiners. And, he was sitting here and on the other side, and, and it was a cardiovascular, it was a cardiovascular medicine station or cardiology station. And he was asking me these questions. And, as I was responding, he would light up, that's him. It's like, yes, and
Yeah.
and then, and that was him. And he then invited me to his office to ask me what my plans were. I told him about my ambition to apply for the Rhodes Scholarship, and that for us was the beginning of our proper mentorship relationship. He supported me as I wanted to do some research during my time as a medical student in my fourth, fifth, and sixth year. And he stayed in touch during my time in Oxford, supported me in getting additional funding for my PhD. And really, every time I was in the UK, he would always stop over, at Oxford, or he'd invite me to London. And so I was gutted when I learned of his passing. And the one last thing I wanted to say is that, this was a prof that really backed your dreams and your own, your own dreams. And when I told him that I wouldn't do cardiology, and I wanted to venture into entrepreneurship, he was like, "How do I support you?" You
Wow.
know? And that's one of the things I will always appreciate about Prof.
Yeah. I've heard so many good things about him.
Mm.
That was beautiful. Um, so you are now the CEO and co-founder at Quro Medical. Could you please tell us what Quro is? So what problem are you solving at Quro and how are you solving it?
Great. So Quro Medical is fundamentally a digital health company. So we leverage technology and harness the best of our people to improve the well-being of others. We have got, our big vision is making healthcare both geographically and financially accessible for everyone. And interestingly, we introduce a new word in our vision, which is making healthcare more accessible and more affordable, right? Because we wanted to, yes, we'd come in and maybe beat that based on the status quo, but we always wanted to beat ourselves, right? And that for us is something that is always exciting. And as a digital health company, we've got different clinical pillars. And one of those clinical pillars is a product called Hospital at Home, or technology-enabled Hospital at Home, where we are able to treat patients from the comfort of their own home for who have clinical conditions that would otherwise require in-hospital care. We leverage technology to provide real-time monitoring. The patients, we've got a proprietary platform where the doctors are able to log on to the platform and see how the patients are doing. We have mobile care teams that go out and deliver care to the patients across the board, from clinical associates, also known as physician assistants, to nurses and doctors. Um, we leveraging the power of technology. Our patients have got clinical grade, or they wear clinical grade wearables that transmit data in, their physiological data in real time to our 24-hour command center. And we have a network of emergency medical services providers who, based on our predictive analytics, if a patient deteriorates, we're able to dispatch the necessary emergency medical support. And then we've got on-demand services that we are also able to bring to the patients to the home. So whether that is uh, medication or physiotherapy or laboratory stuff. Our biggest challenge at the moment is bringing imaging, so x-rays and ultrasounds, all to the patient. So really taking all the essential elements of in-hospital care, bring that to the patient's home, enroll them into what is truly a patient-centric service, and at a fraction of the cost, but with better clinical outcomes. That is our flagship program, but we do have other programs designed to reduce readmissions. We've got a screening and prevention program that is happening in the context of home, and a few other programs that are actually in our pipeline. And so when we started out to build what would be the largest virtual hospital that focused on general ward patients, that has now evolved to building the largest virtual hospital ecosystem, because we want to be able to look after patients across the care continuum.
Yeah. Wow. That's really exciting. And it's quite interesting actually, because I mean, someone who's not trained in medicine like myself, thinks that everyone who's unwell should be in a hospital, they should be in a hospital. But, after speaking to like friends and people I know that actually have studied medicine, you begin to realize that, we don't want people to be in hospital as much as possible. We only want you there if there's something we can do for you there to help you. Otherwise, you better to be at home, really.
Absolutely. Absolutely. I think our goal is pretty simple. And that is, let's create an environment where patients are able to access care in the most appropriate setting, for the most appropriate duration, at the right cost,
Mhm.
for the right duration, right? And I think in the absence of alternatives, hospitals make sense. But as you then introduce, companies like Quro Medical that are able to deliver care that is safe in the patient's home, where recovery is better and the clinical outcomes are better, I do think that healthcare systems need to move towards that. Unfortunately for us, there seems to be a global movement in that direction.
Sure. So South Africa faces, or at least the South African healthcare system faces like a set of challenges, which may or may not be unique to South Africa. Examples being like shortage of healthcare workers, as well as now the rising number of young unemployed doctors. How do you see Quro Medical and solutions like it speaking to these challenges?
No, absolutely. I do believe that a lot of our ability to solve some of these intractable problems require a very entrepreneurial approach, right? And again, where we introduce, solutions that are accessible, highly scalable, and sustainable, right? And you speak of the you speak of the let's say healthcare professionals, right? One of the things that we've been reflecting on is that we spend most of our training, looking after patients in hospitals, whereas once you go into practice, most of those patients are not in hospitals. You look at doctors who great at managing a diabetic in the in-hospital setting, but once the patient is in the community, guys run into quite a bit of trouble. And I think it's important for us to kind of train, like our training and our healthcare system must be responsive to the needs of our people. We must be able to move our people to where they are. So we can't purely train hospitalists in an environment or a country that requires, increasingly so, care in the community, right? We also need to start thinking about, things like, how do we get people practicing on the top of their licenses, right? We've got situations here where specialists are seeing cases that general practitioners are seeing. And general practitioners are seeing patients potentially primary care nurses are meant to see, etc. So we are even inefficient with the resources that we have. And I think there's a potential for us to unlock that, right? And then the third part for us is, you know, we cannot be delusional about where we are, right? The nature of our challenges is that the healthcare crisis that the world is facing, South Africa included, is urgent, right? And so we must then think about how do we best utilize how do we best utilize our resources in an environment where there's the greatest need. Now, it is common cause that hospitalization is one of the biggest expenses. It's the biggest driver of healthcare. Well, if you build more hospitals, you'll increase those costs. But when you then start thinking about, well, if we are able to potentially manage these patients outside of that environment, or at least turn over the beds that we do have. So we limit the time in which they've got their contacts, optimize the care of their patients, transition them safely into the care environment, and then have dedicated teams who are able to look after these patients in the at-home space, even them practicing in the top of their license. You know what I mean? For example, here, well, if there are certain conditions that don't require doctors to be in the home, don't send doctors. Send someone else who will be at the top of their license.
Yeah.
And when that comes to an end, send community healthcare workers to provide that care, right? And so I do think that it requires, a little bit of reflection from our side to look at what does our burden of disease look like, and what would our healthcare system need to look like to be able to respond to its healthcare needs today, tomorrow, and in the future, right? Um,
Yeah.
and I think organizations like Quro Medical think about healthcare in that way. The difference here is that, we see ourselves in many ways as this like public sector R&D lab, right? Where yes, we may be sitting in the private sector, but part of that is because we want to be able to trial out solutions, right? We're able to introduce new programs in a way that is sustainable. And we can demonstrate that, well, if it's good enough for Gems and Discovery to pay for it, it'll be good enough for government, right? And if I'm in the private sector and I can access these care, we should be able to extend that to patients in the public sector, right? Our patients are sitting in Houghton and in Simonstown and in other parts of other affluent communities in South Africa, as much as they are sitting in Khayelitsha and Dobsonville and Tembisa. We've got clinical teams across the board delivering the kind of care that is required. But we also try to demonstrate that actually this thing's sustainable, right? It can be well priced. There are sound clinical economic models. We then also demonstrate that there are human resources that are available to be able to drive that, and that you can collaborate with other players in healthcare to ensure sustainability. Now, once you have that template, you can actually take that and say, how does this template look like at great scale in the context of the public sector? And that's part of our goal, right? To be able to kind of export some of this work so that we can apply it at great scale in those areas, and then look into solving the next challenge in the chronic diseases space, the next challenge in all these different environments. And so in many ways, I've created my own group, if you will, that I would have ordinarily had in academia. The difference here is that I'm able to do that in a very, very different setting.
Yeah. Yeah. So basically you're pioneering something, a model that's very optimized, for the problems that you face, you know.
And again, I don't want us I don't want us to kind of reduce it to either just product or model. I think what we're truly pioneering is a way of thinking about healthcare, right? And I think we've got specific products that we are launching as an outcome of that process. But for as long as there are, um, challenges in healthcare, we've got the kind of minds within our organization that ideate, implement, roll out so that the impact is far greater than just within Quro. And I think for me, that is the thing that I enjoy most about this organization. When I was doing the MBA, I was asked whether, was this Vuyane is just trying to spend more time in Oxford or stay here? And my response was, Oxford is not home, right? What I do want to do is to be able to create an organization where we are able to attract the best and the brightest to solve intractable problems that the world was facing, Africa in particular, and of course South Africa. And I think for us, that is where we are as an organization, and to do so in a way that's sustainable.
Yeah. Interesting. So what do you say to this question? Because it was actually one of my questions that I had for you later, but it may be best to talk about it now. You came to Oxford, and I'm picking up that the idea behind Quro was already there in your later years in Oxford. Um, so you could have founded Quro, headquartered Quro somewhere in the United Kingdom. And my understanding is one of your co-founders studied in the US. So you could have maybe co-founded Quro in the US. Why South Africa specifically?
Um, a number of things. So we did actually try. In fact, when we started Quro, we were trying to solve a problem that the NHS was facing at the time, where they were not discharging patients timelessly, and doctors were concerned that they couldn't monitor and look after patients in the home. But South Africa was facing a similar challenge, right? And here we had home ground advantage. It was a healthcare system we were most familiar with. Um, Also, I just was ready to come home, man. Like I wanted to come home. Building an organization is incredibly hard, and having a solid support structure is critical to your ability to do that and to do that well. And I don't think I necessarily had that foresight back then. But I'm glad, if that was sitting in my subconscious, I'm glad it happened, because as I was building this business, I leaned more and more to the support structure that I had managed to create in family and friends, and other people within my network. And so those are the things that really, really informed us, and really we wanted the best chances of success, and not just financially, but from an impact perspective, right? And so our desire to want to do it in the UK, we felt that the healthcare systems were so similar, and that we'll be able to set it up here and still be able to go home, which is where we wanted to have that impact. But what's interesting now is that the opposite seems true, in that we are now exploring opportunities in the UK, right? Having built and demonstrated the value of the business here. And so I would say those are, those are the things. And then the last thing was that I remember reading something where someone had referred to innovation that starts in African countries or the global south, that then move on to the global north as reverse innovation. And that frustrated me, because the reality here is that, you know, the healthcare challenge is the same world over. And, the global north has struggled for decades to solve that, even when they've had models such as the NHS, right? And I think as as a people who are having to solve challenges amidst other issues, load shedding. If you have to innovate and think about how does your technology move in an environment where there's crime and there's load shedding and connectivity issues and you crack your solution, and if you're able to scale it there, your ability to scale it in other parts. And I mean, again, I don't want to be naive. You'll face different challenges, but it tends to be a lot more easier than being able to do it here. And so all of those things informed and shaped our decision to set it up, at home. And yeah, and I miss my mom, so I came home.
Nice. I'm sure she'll be very happy to hear that. Though I'm sure you living in Johannesburg instead of Cape Town presents its own challenges.
She's a lot happier that I'm a 2-hour flight away.
Yeah. All right. You also mentioned there you're open about challenges that exist within any entrepreneurial journey, and it's quite hard to start a venture from the ground up. I remember having a conversation with you some time ago, and you mentioned a bit about challenges that you had, when you had these ambitions coming back in 2018 to start Quro. Could you please share some of the things you found really difficult at the beginning that you may not have been expecting?
Yeah. I think the first one was, I guess, my own readiness, right? I assumed that when I landed, from the UK. I would attract funding. I'll have people queuing up to work with me. We'll be able to do that, and there'll be like this really great story, Dr. Mhlomi lands from Oxford, set up this venture, receives, unlimited funding to be able to solve South Africa's challenges. And that was not the case. It was incredibly, incredibly hard. And, some challenges were bureaucratic, some challenges were financial. But I think that the biggest one was me, right? And my own assumptions about what it would take. Whenever I speak to entrepreneurs, or people who aspire to be entrepreneurs, I do not one bit romanticize the idea of entrepreneurship. It's incredibly hard. And you need to be very clear that this is something that you want to do. It shouldn't be something you want to do because you think it's easier than a 9 to 5. That's not the case, right? And I remember the first few months of trying to set this thing up and really hitting one wall and a closed door and all of these things. And, wanting to then go back and change the business model, and at one point I remember I wanted to buy a practice and I was like, I'm going to consult in the front and then at the back we'll do something else. And this is where we'll build a team, etc. And a friend of mine said, Vuyane, you know how you often say that when people invest in your business, they don't just invest in the jockey. They don't invest in the horse or the business, they invest in the jockey. Maybe this period is designed to work on the jockey. There's nothing wrong with the horse. There's nothing wrong with your business model. And so every time you run into something that tests your character, you then want to go and change the business model. And that was probably the best advice I'd received because after that, I remember that November, towards the end of that, I literally stopped. I went home and I spent time with my mom. We then drove to the Eastern Cape, to the rural Eastern Cape for many days where I was like offline and really just reflecting on my state of readiness and what it is that I would be required and where I'd need to be. And that I was not entitled to anyone's funding. I wasn't entitled to an easy road. I wasn't entitled to the market opening up, and that I would face all these different challenges that are inherent in entrepreneurship. And so, and again, I'm not, and I'll contextualize that when I then speak about, I think, challenges that are unique to Black entrepreneurs.
Yeah.
But I do want to highlight the importance of that work and the work, everyone will tell you about who've worked for corporation about kind of the founders syndrome, about how the founders are always these problematic characters that get in the way of their businesses. And I think in part, it's because they don't do that internal work that needs to be done. And that for me was so important because every challenge that we subsequently faced, I was then ready to deal with, with the challenges. And that being said, outside of that, building a business in SA and even attracting, funding is difficult. And I think the experiences of Black entrepreneurs are unique, right? I was told that, well, in order for you to get funding, you need to have gone to the right schools. You need to, have the right network. You need to have the right twang and etc. Right? But you soon learn that none of that is enough, right? You need to have been the president of the United States. You need to have gone to the moon at least twice. You need to have cured cancer and won the Nobel Prize on numerous occasions just to get, a seat at the table to have a brief conversation, with someone about what it is you have to offer. Whereas I've seen some of my peers of Lighter Hughes, with half-baked ideas, have funding and resources thrown at them. And, I remember reflecting, going, like, if this is how difficult it is for me, I shudder to think what an entrepreneur who's from Khayelitsha is having to deal with it. And so I do think that there are structural limitations that are inherent in how South Africa thinks and funds and supports entrepreneurs that actually get and limit our ability to succeed as entrepreneurs. Nevertheless, after a number of challenges, we managed to attract some really great investors that were truly supportive of not just what we were building and our vision, but also the people that we're building. And we continue to have them back our business. But we also beyond that had some really fantastic partners who were willing to, support them. I mean, I remember, MedScheme, within the Afrocentric group took a shot at us and say, look, we're in the midst of COVID. We're looking for different solutions. You're a young company, but we're willing to give you a shot. They remain one of our biggest clients, and and we continue to do some of that work. So it's not doom and gloom,
Yeah.
but there are also sort of practical realities that I think we all need to consider. And I think I faced some of these.
Sure, sure. Thank you for that. So I was actually watching one of your online interviews, and after finishing the video, I went to the comment section, and someone there said, "Oh, Dr. Mhlomi is so wise. I wish that he had a podcast or YouTube channel so that he could share more of this wisdom." To my knowledge, you don't have such a platform, so I'll extract this wisdom from you. So what advice would you give to a young person who is interested in contributing to society and also living a meaningful life?
In Xhosa, we say, "Awuphi ngasandla sinye," so you don't give with, ne? Awuphi ngasandla sombini, yes. Ne? In that you don't give with both hands. You give a compliment and then you go and ask me a very difficult question. Um, the, um, in my fifth year of med school, I had, we had one of these oral exams, and I distinctly remember one of the stations being a station where it was obstetrics and gynecology, and they gave us a case where this woman, after having delivered her baby, she was bleeding uncontrollably. And so they asked us, what do you do? And there's a protocol that you follow, right? Step one is call for help. Step two is, you then attend to the patient, etc. And then you follow the rest of the steps. And so I turned to this examiner and I say, well, I would call for help. And then she says, you are the help. And I was like, well, I would call for more help. It's like, you the help. And I think for me, that's one of the things that I reflect on a lot. And that is, we often assume that there's going to be some or other savior that is going to come through and take us as a country and as a people, save us from the challenges that we're facing. And I think the sooner we realize that we are the help, the sooner we are likely to get out of some of the challenges that we're facing, because it is within our reach to be able to solve them, right? What is happening, for example, in the United States is a clear demonstration that for as long as we sideline politics as young people,
Yeah.
um, very quickly countries and even the world descends into exactly what we're facing. And so we have to think about how then are we developing leaders for the next generation. When we think about technology and thinking that our solutions will solely come from the likes of Elon Musk, and we are not actively training the next engineers who are socially conscious, where people are looking at the challenges that we're facing and we become the help, we run into the same challenges. If we are not thinking about healthcare and the challenges we are facing, that the countries and our people are facing, and thinking that someone else is going to come and face us, we will always be here 50 years down the line. And I think my invitation to a lot of people is firstly to think about and to firstly reflect on the country and our people, and recognizing that a lot of the solutions actually are within our reach if we're able to solve. I always say, I mean, even within our own organization, create value. Currency will always follow value, right? And that's our goal, right? And the same thing is true for people who truly want to go out there and do something impactful. For as long as you're solving for yourself, if the solution is, I want to be a millionaire,
Yeah.
very difficult, right? But if actually your goal becomes, how do I create value? How do I ensure that I leave the world in a much, much better place than how I found it? What normally happens is that you will realize that there are a lot of people that are willing to back that vision, right? Myself included, right? Um, the world often gravitates towards those people, and often the currency follows, right?
Yeah.
And in particular in Africa, right? In that the challenges that we're facing, like, they're not Facebook stuff, they're not WhatsApp, right? They are a matter of life and health, life or death, right? It's
Yeah.
education, it's poverty, it's devastating effects of climate change, it's housing, it's all of these things. And the more people who are able to put their minds and resources to address that, the more we, um, you know, are intentional about strategically placing people in spaces where they can thrive, the more we're able to invest in institutions and institutions of learning and education to support the kind of people who truly want to make a difference, the greater the prospects of us being a much, much better nation and a much, much better people. And so I always have time for people who are primarily led by the desire to make the world a better place, and then you'll be rich. That for me is it. And I don't get me wrong. I don't think that the only solution is through nonprofits. No, no, no. I think we are a socially conscious, purpose-driven organization, but we are for profit because we recognize that the nature of our work has to be sustainable. You know what I mean? But the primary driver is not money,
Yeah.
right? And my fundamental belief is, like, do well by doing good, right? And I think for me, the primary stop is, why do you want to do that? And then going, find the country needs it, our people need it, and that. What do I need to do to be able to do that? So what are the instruments that I need from an education perspective, from a resource perspective, from a network perspective, etc. And then lastly, do it. You know, my one big challenge after Oxford was, at the end of the DPhil, and then of course the MBA, was I never quite felt ready to
Yeah.
come and do it. There was always something that was missing. You know, I was like, oh, maybe I need to go and work at the World Bank. I'll acquire more skills. And then maybe from there, there's always one more thing, until a good friend of mine who does have a podcast, Caesar and Bofa Walsh,
Yeah.
said, Vuyane, come back home, right?
Mhm.
You've been swimming upstream. There's not one more thing you need to do. Come back home and come and do the things that you say on. And that was the one instruction that I lead into, and the one counsel I heeded, and I came and I built. And on this part, have I been a CEO before? Not a chance. Like, I've never been a CEO. I don't know what it means and what it looks like to be able to build a business. Fast forward, we've got, what, 65 going to 70 full-time employees. We're present in 5 of the 9 provinces. We've seen over 110,000 admission days. Our patients love what we do. We look after almost 90% of the medical schemes within South Africa. We're exploring, um, business across the board. And the reality is that none of this, like, if you had asked me back then if I was ready for any of this,
Yeah.
definitely not, right? But I'm glad I did. And so the third bit of wisdom is, start, right? You will never be ready.
Sure. Nice. That was so good. Interestingly, I was thinking to myself actually before we started recording this, I was thinking, because I do watch this podcast quite a lot. So
Mm.
there's a time when he actually gave you a shout out. So I was like,
Yes.
actually, Caesar shouts out Vuyane, I invite him. So yeah. Um, my last question to you, anyone who's met you and gets to know you will know that you take your fitness quite seriously. But it was not until I started following you on Strava that I realized just how seriously your training is. Could you please, share with us like why so much activity?
Yeah, great question. 2 reasons. One is I realized a few years ago that actually my 2 biggest assets physical health and mental health. And the only way I'm able to show up, if any of those two are compromised, it limits my ability to show up. Now, these things don't just happen. I actually have to take great care. Physically, I need to be active. Two, I need to sleep. And three, I need to be able to engage in the kind of things that keep me both spiritually and mentally nourished. And so what you see, I guess, on Strava and all the other places, the fraction of the many things that I do. Um, so I sleep about 7, 8, sometimes 9 hours a day. But I go to bed very early. So I'm usually in bed by 8, 8:30. And then I wake up at 4 and, praise, flexibility, exercise, etc. And then I go off and I start my training depending on what I need to do on the day, whether it's swimming, cycling, strength training, and running, etc. And that's also a space where I get to like think and I reflect. Those that have run into me, for example, even at gym, know that I'm always in my head. It's a time for me to reflect, right? And so I do that because, again, to protect these two critical assets. My friends. So I don't have kids. I'm turning 37. And, some of my friends would say, oh, no, you're going to have kids when you're very age, and you're going to be able to run around, with the kids. And I was like, sorry, I'm not going to be the kind of, parent or older guy that doesn't have vitality. I'll be very energetic. I'll be well. And even at 70 and at 80, I still want to be physically fit and strong. And again, that doesn't just happen. You know what I mean? You have to take very decisive steps to be able to have that and to be able to do that. And so, yeah, that's one of the reasons I guess I'm active.
Yeah. Well, Vuyane, thank you so much. I really enjoyed the responses to my questions. You were quite generous with the responses, which I always appreciate. And yeah, I hope this is not the first and last time that I have you here. So yeah, hopefully you become a regular on this podcast. Thank you so much for your time.
Oh, bless you, and thank you so much for inviting me.
All right. Cheers.
Brilliant.